have decided to do my presentation on clinical depression, also known as major depressive disorder. Now I'll provide a clinical definition of depression. Clinical depression is known as the most severe type of depression and also one of the most common forms of depression. According to the DSM-5 diagnostic criteria for major depressive disorder, a person must display 5 or more of the list of symptoms below. These symptoms must be present for at least a 2-week period and involve a change from the individual's previous functioning. At least one of the symptoms must be either 1, depressed mood, or 2, loss of interest or pleasure in daily activities. These symptoms must not be directly caused by another illness in order to be classified as symptoms of depression. Number 1, emotions of hopelessness, sadness, and or irritability most of the day and nearly every day. 2, loss of interest or pleasure in all or almost all activities for most of the day, nearly every day. Significant weight loss without dieting or weight gain as well. Example would be a change in more than 3% of the individual's body weight in the span of a month. Or an increase/decrease in appetite nearly every day. 4 is insomnia or hypersomnia nearly every day. 5 is psychomotor retardation or agitation nearly every day, specifically observable by others. 6, fatigue or loss of energy nearly every day. 7, feelings of worthlessness or excessive inappropriate guilt, possibly even delusional guilt, nearly every day. 8, diminished ability to think, concentrate, and make decisions nearly every day in a way that is observable by others. 9, recurrent thoughts of death, not only fear of dying, but reoccurrent suicidal ideation without a plan or a suicide attempt or a plan for committing suicide. These symptoms cause clinically significant distress or impairment in social, occupational, or other areas of functioning for the individual. Some potential additional symptoms of clinical depression include gut problems, specifically digestion issues and belly pain, constant tiredness, like limb pain, back pain, headaches, sexual dysfunction, difficulty remembering things, and joint pain. The prophet Jeremiah suffered from symptoms of clinical depression. Jeremiah's emotional pain was so severe that he obtained the title, the Weeping Prophet. The etiology of Jeremiah's symptoms of clinical depression. Exposure to psychological abuse has been proven to increase the odds of an individual developing clinical depression. Jeremiah suffered many forms of emotional abuse. He was threatened by a king, he was ridiculed, he was accused of lying, and Jeremiah's family turned against him and even planned to kill him. Exposure to physical abuse has been proven to increase the likelihood of an individual developing clinical depression. Jeremiah suffered from many forms of physical abuse. He was whipped and put in stocks. A few of Zedekiah's princes had Jeremiah arrested, beaten, thrown in jail, and accused of treason. He was threatened with a death sentence. He was attacked by a mob. He was thrown in a deep and empty well. He lived through the siege of Jerusalem along with the rest and was there as the people were taken away as captives. Loneliness has been proven to cause clinical depression. Jeremiah suffered loneliness. He was not allowed to marry. His family abandoned him. The people turned against him. He said that he was hated everywhere he went and that everyone cursed him. DSM diagnostic criteria. So here is the official diagnostic criteria for clinical depression. So I will read through it pretty quickly and then we'll continue on. Now, to analyze Jeremiah in scriptures and discover if he displayed 5 or more of the list of symptoms below. We must look into whether or not these symptoms were present for at least a 2-week period, and if they involved a change from Jeremiah's previous functioning. At least one of Jeremiah's symptoms must be either 1, depressed mood, or 2, loss of interest, pleasure. These symptoms must also not be directly caused by another illness that Jeremiah had in order to be classified as symptoms of depression. So we have here Jeremiah's specific symptoms of depression include number 1, emotions of overwhelming hopelessness, sadness, and irritability most of the day and nearly every day. And here we have lots of quotes from the book of Jeremiah, about 7, where he is expressing these symptoms. He also had symptom set number 2. He had a loss of interest in pleasure in all or almost all activities for most of the day, nearly every day. Here we have 2 citations in Jeremiah of him suffering from that. If you want to look more closely and just kind of get a better idea, you can. He had symptoms of number 5. Specifically, what it was his psychomotor retardation / agitation nearly every day. And it's assumed it would make sense that it was observable by others because it says that he was like a drunk man. And if he's like a drunk man, that would clearly be observable by others. He had symptoms of number 7, which was feelings of worthlessness and excessive inappropriate guilt. He had symptoms of number 9, recurrent thoughts of death, not only the fear of dying, but suicidal ideation. And so here, Jeremiah displayed 5 of the listed symptoms above, specifically 1, 2, 5, 7, and 9. It is possible that Jeremiah suffered from other symptoms listed above, but it cannot be determined because of the limited information provided in the scriptures. We must look into whether or not these symptoms were present for at least a 2-week period, and if they involved a change from Jeremiah's previous functioning. We do know that his emotional stress was long in duration because he wrote that he would weep day and night for the slain of his people, and also wrote that his entire life was filled with trouble, sorrow, and shame. However, the scriptures do not appear to indicate the duration of his 3, 7, and 9 symptoms. It is apparent that there was a change from Jeremiah's previous functioning because he wrote that his joy was gone, suggesting he previously had joy. Not only were 1 or 2 one of Jeremiah's symptoms, but both 1 and 2 were Jeremiah's symptoms. I could find no information indicating that these symptoms were directly caused by another illness that Jeremiah had. diagnostic conclusion of this is that it appears very likely that Jeremiah had clinical depression, but because of a lack of information, it would be unprofessional for him to receive a contemporary diagnosis. How did Jeremiah's symptoms impact his quality of life? Jeremiah's emotions of overwhelming hopelessness, sadness, and irritability most of the day and nearly every day led him to see his life as a prison. Jeremiah's loss of pleasure in all or almost all activities for most of the day, nearly every day, caused him to have a generally unenjoyable life and prefer to dedicate his time entirely to weeping rather than taking part in different activities. Jeremiah's psychomotor retardation, specifically trembling bones and being as drunken as a drunken man, would have implied that his physical and mental functioning was poor. This would have limited him much in life. Jeremiah's recurrent thoughts of death and suicidal ideations clearly display his personal belief that his life was of no value. God at work in Jeremiah's life. God said that before Jeremiah was born, he consecrated him specifically to be a prophet to the nations. God comforted Jeremiah by telling him to restrain his voice from weeping and his eyes from tears, promising that his work would be rewarded. God told Jeremiah to not trust his family even though they spoke well of him. God told Jeremiah to not be afraid and promised to deliver him. God's work brought some joy and delight to Jeremiah's heart. God promised to deliver Jeremiah out of the hand of the wicked and redeem him from the grasp of ruthless men. There are treatments for Jeremiah's symptoms of clinical depression. Psychotherapy. Jeremiah would have benefited from receiving psychotherapy from a mental health professional. Jeremiah could identify and change his unhealthy emotions, such as thoughts and behaviors. Jeremiah's symptoms would likely be treated with cognitive behavioral therapy, and he may have been in need of this therapy for several months or years. Medication. Prescription medications such as antidepressants would have changed Jeremiah's brain chemistry and as a result would most likely treat his depression. Complementary medicine. Jeremiah may have been able to improve his well-being with therapies such as acupuncture, massage, hypnosis, and biofeedback in addition to traditional medicine. Brain stimulation therapy. Jeremiah may have benefited from brain stimulation therapy because it has been proven to help people who have severe depression or depression with psychosis. The specific types of therapy could have been ECT, TMS, or VNS that he could have received and possibly been helped by. There are also things Jeremiah could have done on his own to help improve his depression symptoms, including regular exercise, getting quality sleep, not too little or not too much, having a healthy diet, avoiding alcohol because it is a depressant, spending time with people Jeremiah cared about, if there were any. It sounded like there wasn't, but if there was some, it would have been helpful to spend time with them. Why did I choose to study Jeremiah for this assignment? I determined it would be relatively easy to find scriptures to prove that he may have fit the diagnostic criteria for clinical depression. I also have suffered from symptoms of clinical depression my whole life and have only recently begun to recover from them. I feel intense understanding of Jeremiah's pain. And that is